The Trump administration has plans to replace immigrant workers with Medicaid recipients. Here is the official statement by Brooke Rollins, who is the U.S. Secretary of the Department of Agriculture.
The mass deportations continue, but in a strategic way, and we move the workforce towards automation and 100% American participation, which again, with 34 million people, able-bodied adults on Medicaid, we should be able to do that fairly quickly.
There's quite a bit to unpack in that clip. We're going to focus on the 34 million Americans who are now at risk of potentially losing their health care due to new Medicaid work requirements. First, let's start by looking at Medicaid enrollment data that is available to us from Medicaid.gov. As of March 2025, there were 78.6 million people enrolled in Medicaid. 37.3 million of those people were enrolled in either CHIP, which is the Children's Health Insurance Program, or were children otherwise enrolled through their states. We can remove the children from the potential labor force, for now. That leaves us with a little over 41 million adults. The March 2024 ASEC showed that 64% of adults on Medicaid were employed, either part-time or full-time. After subtracting the people who were already working, we have 14.9 million adults left. That's a lot of potential workers for sure, but we still have two more demographics that we need to talk about: seniors and Americans with disabilities. According to the ACS, there are 15 million Americans with disabilities who are enrolled in Medicaid. There is overlap in this demographic. For example, you can be a child and be disabled. We know that there are 2.7 million Americans receiving Social Security disability benefits and 2.4 million Americans that are covered by both Medicaid and Medicare. We can remove these two groups because they have circumstances that would exempt them from having work requirements. That leaves us roughly 9.5 million Americans who are on Medicaid but are not working. According to a 2025 Pew Research study of U.S. Census data, of the 9.5 million people who didn't work, 3.2 million cited caregiving responsibilities as a reason, while 1.7 million said that they were in school, and 2.6 million cited illness or disabilities that wouldn't count towards Social Security disability as a reason for not working. That leaves us with 2 million adults that are enrolled in Medicaid and are not employed. That brings us back to the beginning. Who are the 34 million Americans who are now at risk of losing their health care due to new work requirements? We don't know. Current and historical data do not support the claims that are being made by the Trump administration. We can speculate, of course, by looking at the most vulnerable groups who are currently covered by Medicaid, but for now, it is important to be aware that the Trump administration has plans to replace immigrant workers with Medicaid recipients. That's it for now. Take care of yourself, be kind to yourself and everyone and everything around you, and I'll see you in another video. Bye, everyone.